health meets technology, wellness becomes smarter, faster, and more personal. Good evening and welcome to another beautiful episode of Smart Challenge 2026, where bright young minds meet bold ideas to shape the future. I am still your host, Love Diamond, and I'm super excited to lead you through tonight's edition. Why? Because we shall be celebrating innovation and healthcare at our fingertips. A round of applause for all the schools that we're expecting to present today. HealthTech is simply using innovation to make healthcare better, smarter, and easily accessible. And I'm excited because tonight, the different schools, the 4 schools that we'll be presenting, will be sharing with us their innovations that they have come up with to make healthcare more accessible to everyday people. Before we move on to that, I'd like to remind us that for the Smart Challenge 2026, we had 16 schools who qualified, who were selected and qualified for this season. And out of the 16 schools, we've had 9 schools present so far. 5 schools presented to PropTech, and we had last week 4 schools who presented to EdTech. And for tonight, the focus is HealthTech. And I'm excited to introduce, of course, our professional judges who are experts in the field of healthcare, and they will be able to guide us through all of the presentations tonight. Can we meet our judges, please? To my right, we have a consultant dermatologist, Lagos University Teaching Hospital. She's also an associate professor, College of Medicine, UNILAG. A round of applause for Dr. Ayesha Akinkugbe. Next to her, we have a lead geophysical data manager at one of Nigeria's major oil companies. Let's give it up for Mr. Osita Okeke. And of course, next to him, we have the founder, CEO, Haralaga. She is Dr. Mambi Madziver. A round of applause for her. And finally, we have the Director, Laboratory Management Services at ISN Medical, with a degree in medicine and surgery from the University of Benin. A round of applause for Dr. Osa Osweta. All right, please. I would like to hear from our judges tonight. What are your expectations from these bright minds?
Well, tonight I'm expecting to be excited.
Okay.
Well, I'm excited as well to see what they all have to offer for us. And I personally like to see a direct link between the challenges that they're talking about and the solutions that they're offering.
Beautiful. Dr. Osita.
Yeah, same thing actually. I'm just expecting to see, these bright minds tantalize us and show us what they've got.
I like that.
We've read their proposals, so it's now, that pitch. Let's see the energy that's going to come from them, because we know that all the solutions, are really great, but let's see them put some energy into it and put some meaning.
Thank you very much, our judges. Remember that these students have been preparing. They have identified a problem, they have come up with a solution, and tonight they will be presenting that solution to us with a very clear business plan on how they plan to execute. Now, we'll be moving straight to invite the schools. First on our list, we have one of Nigeria's fast-growing universities, driving technology and research in northern Nigeria. Can we have Prince Abubakar Audu University, located in Kogi State, Ayumba. Now, when I call out the school, please, you send your representative to come out, okay? Next, we have a school who is consistently ranked among Nigeria's top private universities, known for fostering innovation and leadership. Give it up for Caleb University, Imota, Lagos State. This school was founded by the Catholic Bishops' Conference, dedicated to integrity, knowledge, and service. Give it up for VERITAS University, Buari, Abuja. And finally, on the list of schools presenting today, we have one of Nigeria's emerging federal universities, shaping the next generation of inventors and technologists. Give it up for Federal University of Technology, FUOYE Ekiti in Ekiti State. All right, now it's time for us to determine our sequence of presentation. And to do that, I'll need one from each school to pick a ballot so we can determine who goes first. Okay, so who's going first? Who picked number one? Need help. Just press on it and turn it. Sorry to do this. Okay, so can we review? Who has number one? Who is going first? What university? FUOYE Ekiti is going first. Good. Next. Caleb University. Next. All right. And finally, we have VERITAS. Okay, thank you very much. Now, I would like to welcome for the first presentation, speaking to their innovative ideas as it relates to healthcare. Let's put our hands together as a welcome for their presentation. Federal University of Technology, FUOYE Ekiti. Remember, you have 7 minutes for your presentation. Please keep the time. Are you ready? All right. Your time starts now. 7 minutes.
Several university students break down during emotional stress or due to mental stress and or exam stress and exam tension. As a matter of fact, some even go to a more complicating end of committing suicide. But the question is, where and how can these people get instant and access to immediate help? Good afternoon, co-debaters or my fellow colleagues, the potential investors, co-investors, ladies and gentlemen. My name is Oluwadunsin. Here is Quadri and here is Daniel, and we're presenting to you Mind This, a health problem solving and money making innovation. As a matter of fact, every university student seated down here today should get prepared for their mental health to be tested. Yes, and actually the challenges being faced by university students currently is a rising depression and anxiety among students, fear of stigma causing them to avoid counseling because of some feel like others can make jest of them when maybe they open up about how they feel, social isolation and loneliness and other things like that. Next slide. Why does Mind Ease, our app, matters? The fact is that the World Health Organization, WHO, define health as a state of complete physical, mental, and emotional well-being of an individual, and not just the absence of disease or infirmities. What does that mean? That means that it's not a must that someone says he has malaria before we say, oh, he is unhealthy. So what then if not disease determines health? The major thing that determines health is the mind. Mind is the center of behavior and health. And our app, Mind This, is tackling this problem of health by ensuring that the mind itself is something that is in a perfect state. And as you can see, we have the challenges and solutions. Our Mind This is perfectly tackling the challenges. For example, due to as regards social isolation, we have peer support forum, we have total anonymity, ensuring that users are in a feel free to express themselves in a confined space. We have gamification, ensuring that people or users can make use of this app and enjoy it. We also have hybrid support mode, our unique feature that distinguishes us because we are blending both an AI interface and then human counseling model. Our target audience includes the young adults, students, and general smartphone users. Our secondary target audience are the university counseling centers, student union government, especially welfare directorates, non-governmental organizations that really want to, find out more tips on health awareness. We have our system architecture where Mindies, as I said, it uses AI for that kind of fast response model. And it also uses a kind of RNN dialogue analyzer encoder where some keywords are registered. This app is very beautiful because when a user comes to the app and then is maybe saying, I don't like, maybe I want to kill myself or I'm so tired, it's able to gather information and then tell us about the health or how that individual can be doing. Market analysis, as I said earlier, Mindies is not just a problem-solving app, it's also a money-making app. And mental health app market is on the global scale because as of 2023, this mental health apps was valued at over $6 billion, and in maybe by the next 7 years, 2030, we're expecting a 15 to 20% increase. Next slide. Business model is wanting to create an app and is wanting to sustain it, and we have various ways of ensuring that our app is going to be sustained, and that includes it's going to be affordable and accessible 24/7. It's also going to be something that people can subscribe to enjoy some premium features. Also marketing, and also when when non-government organizations can kind of pay to get some kind of affordable health-related statistics. Our survey analysis, we took out a survey analysis on 100 FUOYE students to see how or what can inspire them to use Mindies. Some said, they really like Mindies as a result, or they want to use Mindies because it can make them aware of their mental health. Some wanted to just kind of have or know what it feels like to maybe as regards sleep and as mood tracking, and some also because of their Android devices. Because of the Android devices, we are requesting or request a seed funding of 2 million naira for the app design and development. We promise that as at year one, as at request for seed funding, we are definitely sure we get access to 2 million subscribers, where 200 will be premium users, and will allow us to generate up to 5 million naira. As at year 2, 8,000 subscribers we're expecting 800 premium users, also a general revenue of 90 million naira plus. Our growth strategy definitely still part of the sustainability, because we want a kind of condition whereby this app is going further and further as regards updates. And one is the multilingual support, ensuring that this is not just university based now, it's going to be global eventually, whereas we can pick different languages and expand to iOS and web version, where it can be able to work on other operating systems, anonymous data insights, collaboration with states and federal government. Our competitive analysis, next slide, as you can see, Mindies beat other health mental app. It beats Calm, Headspace. In fact, the only thing that really makes us not to really stand out is the popularity. And I'm sure as regards the seek funding, it will really work out. Anyways, Mindies is more than an app, actually. It's a movement to restore hope and peace of mind to those who silently struggle. Mindies, what I love about Mindies, or what we love about Mindies, or what gave us the inspiration, is that it explores outside the box of the usual doctor to patient relationship. Instead, it focuses on the mind, which is the major determinant of good health. Every click, every shared story brings us closer to a mentally healthier generation. Together, let's be the voice that helps another mind find ease. Thank you.
Thank you very much. Thank you, Federal University of FUOYE, for that brilliant presentation. Now, can we have questions from our judges?
Yeah, here's the project demo. So this is how to sign up, and you can sign up in your model, or you can sign up using your Google, and you can also sign up using total anonymity, like sign up as a guest. So, and once you sign up, the app will automatically create an avatar for you and automatically create a username for you as well. Next slide. So that's the login. So that's the web interface. So it is basically
Time is up.
the normal social media web interface, so it's user friendly.
Thank
So-
you. Time up. Please, let's have your questions. Go ahead.
Thank you very much for your presentation. I think it's well put together, okay? But I have a couple of questions. Is for this, the demo, is it already built? Is that like a Figma design you have?
Exactly, sir. It's a work in progress, sir.
It's a Figma design?
Yes, sir.
Okay, very well. Then in your slides, when you showed the survey of 100 students, I'm not quite sure what was there.
I think that's a technical issue. We have it here. So we have some.
It was actually on the other slide that we had that we sent.
No, can you? Right here.
Yes,
So-
exactly. So we have something like awareness of mental health importance. So people that are aware of the mental health importance already. So on a scale of 100 students, so that's it. And we also have some other features like freemium, mood tracker.
So I understand that. I mean, for those other bars, what are those?
Yes, what I wanted to say was that as regards that, the slide we practiced initially had all those things. But yes, this slide, I was surprised too. But as I said, I've been, preparing for it. That was why.
Okay.
But the slide we initially had those features.
Could you just mention maybe 2 features? You have it in front of you.
No, it's not.
Oh, it's not there.
It's not
Okay.
But we know them. We have something like freemium. And the subscription model, maybe the amount of subscription, 1,000, 5,000 monthly. And we also have something like mood tracker, emotion tracker, music, tense music. So people that are ready to use it based on music, based on emotion, based on anxiety and so. So that's what the review and the analysis is based on.
Okay, thank you.
I have a follow-up question to that. Did you happen to ask any of the students whether this is an app that they would continue to use for a long time, or they would just download it? Let's say you feel anxious, you download it, you use it, you pay for a few months, and then you stop, or something like that. So can you walk us through how you're thinking about?
Yes, thank you very much, I really appreciate that. Actually, it's not basically a mind project. It have a lot of features like gamification. It also have peer support group where you can talk to people in groups, in forums. Even though there are people you don't know, people across the globe, so you can communicate with them. If your mental health is at its worst state, you don't have to be worrying about the mood, the emotional part of it anymore. So you just have to be maybe playing games to collect rewards and listen to tense music and co. So it makes the app sustain even though people are at their emotional well-being.
Okay.
Thank you very much. And that's a wrap for Federal University of Technology, FUOYE Ekiti. A round of applause for them. Thank you very much. Next, we would like to invite Caleb University for their presentation, please. You have 7 minutes for your presentation. Just confirm that you're ready. Check that your slide is ready. Is that your slide? All right, so check. Caleb University, ready? Your time starts now. 7 minutes.
Every day in hospitals, life-saving information is written and then forgotten. We decided to change that. That's why we created the first of its kind, Clean Sight. Clean Sight is an AI tool that turns doctors' notes into real medical intelligence. Good morning, distinguished judges, my distinguished host, and my fellow students. My name is Akiyemi Toluwanmi, and with me is Tochi Rex Ajero and Aziz Habib. Please, the next slide. The title of our presentation is Extracting Insights from Doctors' Notes Using Clean Sight. Doctors write thousands of notes every single day, from symptoms, side effects, treatment, down to diagnosis. But over 80% of this information is never used because it's trapped in free text in notes. The next slide, please. By analyzing it, hospitals can save millions, improve efficiency, and deliver better patient care. Simply put, Better insights leads to better diagnosis and fewer medical errors. Can I have the next slide? Our solution aligns with the SDG 3, that is the good health and well-being, by improving patient outcomes, reducing medical errors, and enabling data-driven healthcare. It also supports SDG 9, which is innovation and infrastructure, by introducing AI-powered medical data intelligence. Our solution, CleanSight, uses artificial intelligence and natural language processing to turn doctors' notes into structured, actionable insights, helping hospitals make faster, smarter, and safer decisions. Now, Tochi, my partner here, will show how CleanSight works and what it looks like in action. Over to you.
Good day, everyone. My name is Rex, and we have a demo to demonstrate how CleanSight works. So can we get that demo, please?
Continue. Go on.
Okay. So our demo, we designed a web application that turns unstructured doctor notes into medical insights that are understandable and usable by people across the world. For research, our target audience goes hospitals, research teams, and the likes. So our website turns notes that we, as people who aren't even in the medical profession, we don't understand them. So they turn them into things that we could actually make use of in our day-to-day lives. Like me, I'm not into the medical profession, but with this app, I could just get a note from a doctor after an appointment. I can interpret what it does. I know what it will help me do. It's also helpful for pharmacists. Like you just got an appointment with the doctor and he prescribes or just has a note. He has a summary of the interview or the appointment I have with him, and you hand it over to our app. It processes it and brings out meaningful information. Our target audience, like I said, is hospitals, research institutions, pharmacists. They are people who, just go straight to the demo, please. All right. So we have this, that's the sample doctor note. A 52-year-old male, history of hypertension, reports chest pain at night, taking aspirin 7 milligrams daily. This is scatter text. I don't really understand that. But with our app, it has been able to extract insights like the patient demographics, the medical history, chief complaints, current medications, vital signs, and recommended actions.
You have 2 minutes.
It saves a lot of time, and let's head to diabetes management. Now, this is also something else. We can analyze notes, press analyze notes, thank you. And it extracts insights from that notes. So this way, what we don't understand as people who aren't even in the medical profession, even doctors, pharmacists, this helps us save a lot of time by extracting those insights from this unstructured doctor notes. Thank you.
Thank you, Tucci.
Round up.
Next slide, please. So, here is our suite summary. Our strengths are AI, automation, and scalability. The weaknesses are medical jargon and handwriting challenges. And our opportunities are EMR integration and hospital partnerships. EMR can simply be defined as the electronic medical records. And lastly, the threats, which are data security risks and model bias. Next slide, please. So, our
1 minute.
Our funding focus includes clinical data set training, system security, and deployment in hospitals. Next slide, please. CleanSight improves healthcare by enhancing doctors' efficiency, strengthening patient safety, supporting research, and improving the overall health outcomes. Thank you.
In conclusion, CleanSight makes every word count by transforming words into wisdom, one doctor's note at a time. The foundation is ready. The funding helps us take CleanSight to the next level. Thank you very much, and see you in the next one.
A round of applause for Caleb University. Thank you. All right, judges.
Thank you very much, young men from Caleb University. Your product, what you've put together is actually fantastic, right? We can, as doctors, we can relate to what you are saying. It's you understand the problem. You know you've used the right words, going through everything what you submitted, your pitch. You understand the words. You know the words to use to bring out what is necessary from the doctor's notes. However, you are missing the part of what your solution is solving. You are missing that. We can see everything you've put together, but we are missing that solution. That there's a problem. The solution for the problem. I understand you. You say it's mining, right? Mining what? What are we mining? You are just mining doctor's notes. There's more that you can get out of your solution. That's one. Two, you don't have any business model. So what do we work with? There's no business model. There's no financial modeling, nothing, no market analysis. You understand? No competitive analysis. So you need to go back, think on the good you have done, the good things you've put together, and then look again at the other parts of your presentation that you have missed. Thank you
so much.
Thank you very much. One more.
I think nice job, gentlemen. I think it's really well put together, to be honest. But I have a couple of comments here. Just a question. Who are your competitors, and has someone else done what you're doing before?
We don't have any competitor. This is the first of its kind.
First of its kind?
Yeah, this is the first.
Are you sure?
Yeah, I'm sure.
In Nigeria or
worldwide?
Worldwide,
yes.
Okay. So that's number one. And then number two, I think Osa has said that as well. But it sounds more like a research kind of pitch, no business model. So I think that's something you guys need to improve on.
Sir, actually, this is not our presentation. The one that was displayed, it's not actually the one we put together. We submitted another one, but it wasn't. So
you guys have a business model?
Yes, we do.
You do?
Yes, sir.
And you had to show how you can scale your products?
Yes, sir, we do. We have.
I would like to see that.
Okay, but just to add to that, the point is, I'm sure you had a time by which you should have submitted it.
Yes.
So if it was incomplete, because we didn't have it.
Yes.
So I think you need to make sure that you do that, because we didn't have it, and it was part of what is needed. So yes, you have it, but we don't have it here today. Okay, so just for the good. And a last question, quick one. What made you choose this topic?
What's made me choose this topic?
Yes.
Okay. It's something I've actually suffered from. There was a time I had malaria, and we were trying to get to the clinic. It was a general hospital. So we got to the clinic, and I found out that the pharmacist was, straining at I thought she was supposed to understand it, right? It's like she's also in the field. But I saw her straining, and it took so much time. As a matter of fact, we had to go back and get they had to find the doctor and everything. So I spent so much time, and I was like, this is something that could easily be combated. They are in the field, you're supposed to understand it, but she didn't. So that's why I feel it's something that should be done with speed, and it's something that everybody should know. It shouldn't just be, it's just knowledge for the doctors, it's just knowledge for the pharmacist. It should be something that everyone with a mobile phone or a laptop should be able to get.
Thank you.
Thank you, Caleb University. A round of applause for them. Now we'll go on a short break, and when we return, we'll have the next school who will be presenting to us. Welcome back. And if you're just joining us, this is still Smart Challenge 2026 Health Tech Edition. And we've had 2 schools who have presented so far. Remember that at the end of today's episode, we will have 1 winner who will qualify for the grand finale of the Smart Challenge 2026. And they will battle with other contestants to win a 2 million naira grant that will assist them to execute their innovative ideas. A round of applause for all our judges who have been guiding us so far. Thank you so much. And to our presenters, you've been doing fantastic. And for the ones that are yet to come, when you get up here, I need you to present with boldness. You already know what to do, okay? So when you get here, just present with boldness. You have your slides here in front of you. Present with that boldness, okay? So can we move on to the next school? The next school for presentation, we have Prince Abubakar Audu University. A round of applause for them. Kogi State. You have 7 minutes. Are you ready? The time starts now.
Good day, everyone. My name is Okpanashi Tangod, a 300 level student of Prince Abubakar Audu University. And here with me is Daniel Adeko and Nasir Hussein. We proudly present to you digital health, smart and emergency response system. It is a technology-driven health solution developed by Prince Abubakar Audu University, designed to address critical health solutions in Anigba and surrounding communities. It integrates a mobile health application, an emergency response system, that is an SOS wearable device, and a real-time health data dashboard to reduce preventable deaths and improve access to healthcare and strengthen the health information system. With a lean budget of 2.8 million naira, Smart Health aims to pilot within Prince Abubakar Audu University and Anigba Town, then expand to the Kina local governments and beyond, ensuring sustainability through community partnerships. Imagine losing a loved one, not just because help can't come, but because help comes late. And these are problems we are bringing solutions to. According to the Nigerian Demographic Health Survey in 2018, maternal mortality in Kogi State remains above 500 deaths per 100,000 live births. And this is a very serious issue we need to tackle. And also, over-reliance on paper-based health records, causing loss of patients' data, poor emergency response system, leading to delays in life-saving interventions. A lot of people are in hospitals today dying because of diseases or serious issues that could have been prevented long time ago. And we are proposing solutions to all these problems by offering a mobile app for patients, an AI-powered health assistant, affordable IoT wearable for vital monitoring, and telemedicine portal for remote consultation, drug supply chain tracker to combat counterfeits.
Okay, I would like to continue on our demo flow chart.
You have 4 minutes.
Demo flow chart is on the slide. Okay, I'll continue. If you open the demo app, you have the launch page. When you open the home page, you can log in. On the login, you have the home for dashboard for the hospital and then for the patient. And then on the mobile map up there, we have the next slide, please. The slide before this. We have the mobile app in which you can connect your IoT devices, that is your smart wristwatch, to your mobile app. And then the use of the smart wristwatch is for you to be able to take the sensors of your heartbeat, blood pressure, and so on. And then your mobile app is for you to take notes of your record. Next slide, please.
implementation strategies. The phase one of the plot is we already developed the solution at our university, that is Prince Albert Kaladu Universities, and 2 clinics within the community. The second phase of this project, if we are qualified, we want to expand it to Ayimba community and schools, churches, and so on. Then the third phase of the project is statewide adaptations with NGOs and Kogi State Ministry of Health. Next slide, please. The budget requirements. We have the mobile app development and AI integration, which will cost us 1.2 million naira. SOS wristband prototype, 100 units, which will cost us 800,000. Dashboard development and hosting server, which it's not there. Okay, that one will cost us 400,000. And then, next slide, please. Return of investment. The subscription fee from hospitals and clinics per user is 200 naira per month for 5,000 users. That is, you have an income of 12 million naira per year. Then, the third year of the project, if we can have a user of 15,000 to 20,000 users of our mobile apps, that will give us about 36 to 48 million per year based on the sales of the wearable devices. Then we have advertising revenue, and then indirect return of investment. Okay, indirect return of investment, which can help us to reduce preventable debt, improve marital and child survival, job creation for students and local youth. Next slide, please. Benefits to the community, early detection and prevention of diseases. The next point there, we have affordable and accessible healthcare. We have reduction in marital and child mortalities, job creation for local youth, and enhancement of PAAU reputation as a healthTech leader in Nigeria.
1 minute.
Sustainable plan. Smart Health will sustain itself through a subscription model, local devices, and partnership with NGOs and community organizations, which will make the projects to go viral, and not only for users in Kogi State, but at Nigeria and then extended to worldwide. Then the conclusions: Smart Health is cost-effective, scalable, and impactful health tech solution that address critical gaps in health access, emergency response, health data management in Ayimba. Within the investment of 2.8 million sponsored, we can be able to achieve this goal. Thank you.
A round of applause for Prince Abubakar Audu University. Thank you for that brilliant presentation. Now over to our judges' questions.
We've talked about a very lean budget of 2.8 million naira. Is that too lean? I'm wondering, you have both a software component and a hardware component, and typically hardware takes a little bit more funding to be able to execute on that. So can you talk to us a little bit more about how you plan to use those funds? Talk a little bit more about how you arrived at 8,000 naira per prototype, just so that we have a better understanding of whether that ask is going to be enough for you to achieve what you'd like to.
I am a student of mathematical sciences, so the projects can be done easily for us, because with the help of the computer science students, we can be able to develop our website and then the AI applications that we are going to use. So we don't need any cost for that. You can do that in the university there. So for getting the smart wristwatch, the devices, that will be what is going to cost us a little money. But we plan on getting 100 devices at the moment, since we are still in the development stage. Then the phone device, the mobile device that each person is going to use individual, that one can be gotten from any stores, mobile app stores that the individual or the patient can be able to access. That is not part of our project. Our own is to just provide the smart wristwatch that they can connect to their phones. And then we have the...
So just to clarify, the wristwatch, you're importing them, basically. You're buying them from some... Okay.
Yes.
Okay.
Okay, next question.
Mine will be a follow-up question, okay? Especially for the hardware. Where are you importing from? Have you sourced Have you searched for where you can import them from and for what price? Because I think you put a figure that it's not very realistic for 100. So are you importing from China? Where have you sourced where you're going to import from?
Yes.
Okay.
You?
Tell us.
You want to tell us, please?
We are partnering with developers from other schools. Basically, we have not started, but with the research, this is the amount we come up with that we are going to spend on it.
So when you say you're partner with other schools, does it mean that other schools are doing similar thing to what you're doing?
I'm coming. On the notes you said concerning the budget of how we come up with 800,000 per the smartwatch. Okay, we are getting the devices from China, which is going to be imported. So that is how we come up with 100 smartwatches. That is how we have to come up with that amount. And it's not just ordinary, like the normal smartwatch we used to see around. It has the sensors that can take care of all the stuff we listed above in the demo.
Let me ask a question, right? I have a question for you. You are talking about it that it's an emergency response system. Okay, what part of it is emergency? Can you describe that emergency response flow?
Okay. For instance, when we have somebody at home, or to anybody, can happen to anybody actually. For instance, you're at home and then something happens to you immediately that you cannot reach out to somebody. That you cannot, for instance, look for a child or anybody around you to like contact them to take it to the hospital. There's an emergency button there that is indicating SOS button there that you click on it to send a contact. You have already saved the emergency contact on your devices before. So the moment you click on it, to send an SMS straight to the contact you added there. And another thing there is that, for instance, you might collapse instantly that you cannot be able to press it. So the smart wristwatch will be able to detect when you fall down and it will send a message immediately for emergency response.
Thank you very much. Thank you. I'd like to ask, do we have one question from the audience? One question, one comment from the audience about their presentation? Would you like to share your thoughts? Is it something you would be interested to be a part of? Anyone? Okay, let's hear from you. Please come so you can get. Come on, ask a question. Yes, you can stand here. Question, okay.
So I have a question. You said when someone like falls
Come
down
this way and speak to
as
them.
an issue, once he falls down, that the wristwatch will send an SOS message probably to the emergency services that will come first aid, right? So now, if the watch on its own falls down, will it send the message or?
Yes, it will send. That is the default setting. Because you can't tell when somebody will fall down.
Oh. Any follow-up?
Is that okay with you?
So I guess the instructions would be given to the user on
Yes.
how to, as much as possible,
Yes.
handle the watch.
I'll do the watch.
Because you'll be having SOS, not at the right time.
Yes.
All right, thank you so much, Prince Abubakar Audu, University of Kogi State. A round of applause for them. And finally, for tonight's presentation, let's make welcome VERITAS University. You have 7 minutes. Please stick to the time. Ready? The time starts now.
Silence. That's what so many people experience when they cry out for help. Hospitals without staff, clinics without power supply, doors to open. Sealed by inefficiency and neglect. In a world where technology is interconnected, how can health still be seen as luxury? How can health still be seen as luxury? We do not lack knowledge. We do not lack connection. We do not lack knowledge. We do not lack innovation. We lack connection. And that's why Healer is here. Healer is here. Good day. I am Ahame Flechisom, together with my team, Pam Pachak and Emmanuel Afolain. Present to you Healer app, which serves as a bridge to gap between.
Did you know that 70% of Nigeria lack access to quality healthcare, which leads to illness and preventable deaths? With just one doctor for every 6,000 patients, getting access to quality and timely care feels like a lottery. Did you know that Nigeria has 30,000 primary health clinics, 80% of which are non-functional, leaving millions of Nigerians stranded? Nigeria accounts for 29% of the global maternal deaths due to the fact of desperate maternal care and inaccessibility. As of 2025, Nigeria has been projected to have over 4.9 million Nigerians needing access to humanitarian assistance. This is behind every closed clinic's door is a vicious cycle. Underfunded hospitals can't pay their staffs. Doctors live for greener pastures. Broken equipment remain broken, and rural communities are cut off entirely. Healer isn't here to patch this vicious cycle. It is here to bypass it entirely, putting digital healthcare in every pocket of Nigeria. And this is where Healer comes in. Healer is a software designed to bridge the devastating gap of healthcare in Nigeria. It was designed to connect doctors to patients, and patient to verified medical practitioner. Our app offers features that have a positive impact on Nigerians. Our appointment booking, which offers instant appointment booking based on specialty, location, and health needs. Our teleconsultation, which provides secure real-time voice and video care for patients. Our one-tap emergency system that offers rapid ambulance response. Our AI symptom checker, which has been trained with Nigeria illness to offer reliability and relevance. And for users that have low literacy and low internet coverage, our agent supports are there to ensure inclusivity for every Nigerian. Let's talk about the market potential. Nigeria has a population of over 220 million, with 60% of healthcare coming out of pocket, with over 100 million smartphone users in the country and over 50% internet penetration. Nigeria is ripe for the digital health market. The digital health market is growing at a rate of 30% of compound annual growth rate, that which means there's a $1 billion untapped opportunity. We plan on having a total user coverage of 500,000 by the end of year 3, with each user generating a sum of 69,000 per year. We plan on generating our revenue from appointment booking, teleconsultation, B2B marketing and teleconsultation. We are asking for the sum of 100 million to make this software a reality. And of course, this is going to go to data analysis, research, mobile app development, and rural outreach. Our strategic advantage in the Nigerian market is that it's localized for every Nigerian, our multi-affordability plan, and our verified doctor, which are verified using blockchain and the MDCN for licensure check. We offer two subscription plans. Our premium plan, which offers 2 free in-person booking, limited access to AI and offline support. And our premium feature starts at a sum of 5,000 naira per month, which offers unlimited in-person booking.
2 minutes.
Unlimited access to AI features and priority booking. Our vision extends beyond today. We plan on integration with national agencies like the NHIS, NCDC, Red Cross, and the Federal Ministry of Health to offer seamless services for every Nigeria. We plan on partnering with NGOs for rural outreach. We also plan on expanding to all 36 states in Nigeria, including in FCT and other countries in Africa, and to make sure healthcare is accessible for all Africans.
Healer isn't just an app, it's a lifeline, the bridge between need and response. Our vision is simple: to make healthcare accessible, reachable, and affordable to everyone, anytime, anywhere. But to make this possible, we need partners who believe that saving lives shouldn't be a thing of luck or location. Join us to make silence a thing of the past. Join us to rebuild the trust of the healthcare system in Nigeria. Let us heal the system so that the system can heal us. Thank you.
Wow. Thank you, Veritas University, Abuja. Fabulous. What a beautiful presentation. Now let's hear from our judges. Questions?
Thank you very much. Very interesting, very relevant. I enjoyed your financial breakdown, very clear. But I just want to ask you 2 questions. Your fund allocation, you said 200 million. Could you just break that down a bit more in that circle? 100 million. Okay. And then, what was the other one? For the AI symptom checker. So yeah, could you break down the fund allocation? And I like particularly the fact that you've told us exactly what it is, 69,000 per year. But then how does this compete, this 5,000 naira per month with NHIS? And how do you think that problem will come when someone will tell you, I already pay for NHIS? So you can come to that as your second question while you break down this fund allocation.
Okay, answering the first question, it's actually 100 million, not 100 million. So we plan on, for the 100 million, we have divided it into 5 areas: the data analysis, the market research, the mobile dev, and the operations, to cover all operation and other areas the app will need for development. And for the second question, where users that have NHIS won't want to subscribe for, we plan on establishing partnerships with NGOs and other agencies like NHIS to partner with them to offer healthcare for every Nigerian, even if you're under insurance. So you have access to quality healthcare no matter your location.
So if I'm there and I say, oh, I'm already registered under NHIS, will I automatically get this, or will the NHIS cover this cost of the 5,000?
No. Yes, if you are under, we plan with our partnership with NHIS. If you are under NHIS, NHIS will cover your subscription.
Okay.
But if you are not, you will have to pay the 5,000.
Okay. Any other question?
Flyer, and that's you, yeah?
Yes. Yes, sir.
It's nice seeing you without the shades, huh? You had shades in your... It's nice seeing you without the shades. Okay, so I have a question for you. Your application, will it be basically just for connecting patients to doctors? Or you plan on running, pharmaceuticals on it as well? Can someone, after the diagnosis with the doctor, be able to order medication on your app?
Yes, sir. So our software is split into various sections. We have the page section for the patient, the physician, the hospital, pharmacies, and the administrator of the app.
Oh.
So after his consultation,
you didn't show it here.
Yeah, the slide there wasn't like.
You have an opportunity to show.
Yeah,
everything.
we have an opportunity in the prescription side on our demo right now. After a consultation with the doctor, the prescription side. Sorry. After a consultation with the doctor prescribes your drug. Then you take that prescription to any pharmacy or the pharmacy in the hospital, and you are giving your drug. Like this, is waiting for the pharmacy approval that you've gotten your drug. That's how it works. So, we also have other features like the offline access, the emergency contact, and the health record. So in case you go to another hospital, you don't have to call your regular hospital in another state. So they will have your hospital record. So they won't have to be calling another hospital to get your records.
Another one, is your application fire compliant?
Fire, like
FHIR compliant?
Not yet, sir.
Do you know what that means?
Not really.
Okay, so FIRE is the Fast Health Interoperability Resource. So that's actually how, I hear you say you go to other places and then you don't have to have your records there. So you have to be able to make sure that your application is fire compliant. Okay? So that, I mean, it just means that whatever thing you do here, any other app can recognize it. Do you understand?
Yes, sir.
So you have to research into that and just try to make sure that what you're building is fire compliant. Okay?
Okay, sir.
Thank you very much, Veritas University. A round of applause for them. Wow. You've seen how much compassion has gone into the work that they have done, because they saw a problem and they decided to develop a solution for real health problems. Real health solutions for real health problems. This is still Smart Challenge 2026, and we've had 4 schools present to our health tech theme. And now, when we return from the break, we will discover who our winner for this episode is. The winner is going to qualify for the grand finale of Smart Challenge 2026, and they'll be competing with other contestants to win an innovative grant of 2 million naira. I am not sure who that school is going to be, but I'm sure that you viewers at home and the audience here and even our judges are excited to see who that winner will be. A round of applause for our professional judges. Thank you so much for your insight. And to all the presenters, a round of applause for them. When we come back from the break, we will go into the winner for this episode. Thank you.
With your 50 naira, you can win part of over 75 million naira plus cash prizes on University Dual Trivia. Answer trivia from your area of interest, be it sports, STEM, entertainment, or general knowledge. To play University Dual Trivia daily, text UDD. Weekly, text UDW. And monthly, text UDM to 13111. It's exclusive to MTN subscribers only. University Dual Trivia. Be happy.
Welcome back. And if you're just joining us, this is Smart Challenge 2026, the Health Tech edition. And we have had 4 powerful schools present to us on their innovative ideas as it regards to health and technology. Right now, we're going to invite all the presenters upstage. Can we have all the presenters from Veritas University? A round of applause for them. To Prince Abubakar, Audu University. Let's have Federal University of Technology, Oyekiti from Ekiti State. And Caleb University, Imota, Lagos State. All right, just line up. Thank you. Okay, we'd like to hear final words for our judges, comments, advice.
Okay, so well done to you all. It's been a very interesting afternoon listening to all these presentations and for you defending them. I'm sure listening to each other, you also have some tips that you've taken away from each other, what you could have done better, what you shouldn't have done, because we learn from each other every day. So I'll take the comments we split it up. I'll take the comments for Ekiti. Your topic, that's Ekiti.
Ekiti.
Yes, your project was very topical, very necessary, and very important. So for that, we give you a thumbs up. Your images were nice and clear. Very nice images. However, I felt that, for the images where you had the students, which is what you were representing, you had images of Caucasians. We're in Nigeria. Make those pictures more of what you see here. So that's just a comment that way. For your application demo, it wasn't too clear. And then the analysis, it looks great to you that understand it, but for everybody else that's trying to go step by step, could have just been a little more easy to understand. But I give you a big thumbs up for your competitive analysis. That was really excellent. You looked at, what your competitors are doing, and you showed why you think your project should sell. So that was a very, very good point. So well done to you.
Thank you.
Yeah, so for me, I would say congratulations to all of you. So regardless of who wins today, you are all winners. Okay, because I think you guys have done fantastically, and I mean fantastically well. Listening to all of you present with passion, gives me hope. All right, that our youngsters are really thinking, and you guys are going to be the real solution providers in the future. So congratulations to all of you. For Prince Audu Abubakar University, I want to particularly speak to you. I think your project was well researched. You guys presented it very well, and there are some areas of improvement. Okay, you guys also did very good financial model. I liked that, right? But I think next time use more pictures because it's easier to derive insights. Okay, so it's okay to tell me 1, 2, 3, 4, but if you put it in like a pie chart, for example, and I see it in percentages, that will really help. So that's just where I think you guys need to make some improvement. But well done to all of you. Congratulations, all of you.
Dr. Mambi.
I would like to echo those sentiments. Well done to all of you for showing up, for presenting, for putting in all the hard work. And it is exciting and reassuring to see that we have a future for science-driven innovation and entrepreneurship. So I just wanted to congratulate you to all of you, first of all, and hope that you've all learned something that you'll take away from this, whether you win or lose. I'll have some specific comments for HeLa, that's Veritas University, and then I'd like to make some general comments. For HeLa, you were right to say that there's a lot of problems in the healthcare sector in Nigeria. It would have been nice to see a little bit more specificity to see what problem are you actually trying to solve and connect that directly to the solution. It was a little bit of a challenge. You could see we had a lot of questions around what is included in the 5,000 Naira, for instance. What are you getting for participation? How are the partnerships working? That would have been nice to have a little bit more flesh around that. Let me see here. Gosh, I actually had so many comments. I'm trying to to narrow it down. I think it might be useful, and this is probably a comment for all of you, to spend more time with doctors, spend more time with clinicians, to really walk a day in their shoes, a week in their shoes, to really understand their issues, so that you're not just looking at it from a technical point of view, but you're really understanding the user experience part of it, so that makes sense. I would like to see, if you have partners that you're working with, what is your value proposition for them? You're saying, well, we'll partner with whoever the organization is. Why would they want to work with you? You'd have to be able to articulate that for yourselves as well, to be able to sell the partnership to them. And in healthcare, when you're thinking about finances, it's also just as a tip, your user is not always the person who's paying. So just make sure you understand who all your stakeholder is, who is the user and who's paying. I think that might help you out a little bit as you're further developing your plans. I'll stop here for now.
Thank you, Dr. Mambi. Let's hear from Dr. Osa.
I'll echo what everyone has said. You guys have done so well. I mean, when my first words was, I want to be excited, and I really am excited. For everyone here, right, Mambi has said something very critical. Your solution, right, has to be addressed to the person that is going to use it. If you are making a solution for yourself, clinicians, the healthcare providers will not be interested. So like she has rightly said, in one day, just one day, work with either the doctor or the nurse or the medical lab scientist or the radiographer. Do that, and you will see how your solution will be better developed, and will give more. You will have more insight into what is needed. Another thing that I sincerely liked, right, from Caleb, I'm directing to Caleb now, is that you personalized it, which was so good. There, so much comes out of when you personalize a solution. It means you know that there is a problem, and this problem is not just for you because you've seen it, you've experienced it, and that's what everybody else is experiencing. So that was very well done there. Going forward, I will also want to say that one of the main things that you also spoke about, that we saw in your presentation, understanding that interoperability is the bedrock of being able to exchange information. It's just fantastic that that, hold on to that, and you will be able to make a more robust, extremely interesting app. The same goes for every single person here as well. I think another university said that as well. So that is another thing you should, run with. Having said all this, I want to congratulate all of you and tell you that this is just the beginning. They say the sky is the limit. It is the limit. And congratulations and well done.
Thank you. A round of applause. Thank you so much, judges, for such insightful words of wisdom and guidance for these young minds. And to all the presenters, a round of applause for yourselves. You have all done well. But unfortunately, only one school can qualify for the grand finale from this theme. And we're going to find out who that one theme is. At the last episode, we had a male judge announce the winner. For this episode, I would like a female judge to announce the winner to us. Remember, the winner qualifies to compete at the grand finale of the Smart Challenge 2026, where other competitors and innovators will be there to compete to win 2 million naira grants that will help them execute the idea that they have brought to bear. Now, to announce the winner of the Smart Challenge 2026 healthTech edition. Okay, let's have the winner.
Thank you very much. It's been a wonderful evening, and I'm privileged on behalf of the judges to announce the winner. The winner for today is a Federal University
of Technology.
FUOYE, Ekiti. Well done. Congratulations.
Give it up. Congratulations to the Federal University of Technology, Ekiti. Congratulations to you. And to our judges, thank you so much for your time. To all the presenters, well done. You've done a great work showing us how our innovative tech-driven ideas can help everyday people access healthcare at their fingertips. Join us next week for another intriguing episode of the Smart Challenge. This time, we're talking green energy. We're talking clean tech. We're talking green energy. So join us next week for another beautiful edition of the Smart Challenge 2026. I remain your host, Love Diamond, and it has been such a joyride with you.